All those. Yeah.
I mean, come on. Stacy?
Yeah.
And I could tell that sort of something. You're gonna defer.
Yeah, I just want to see what you're.
We'll start sharp, 2:30 sharp.
Cheers.
Stacy.
It still works even if the light's not on. Just push the button. Now try.
All right, welcome everybody. My name is Fletcher Tove. I am the Buncombe County Public Health Emergency Preparedness Coordinator. I want to welcome you and say thank you for being here. We're happy to have the media here as partners in our preparedness and response efforts to ensure that we get accurate and beneficial information to the community. We're continuing to do the legwork and develop and strengthen our partnerships and network of support in a unified whole of government approach. And I just want to emphasize that the steps we're taking and that we're going to share with you today are to protect the most vulnerable in our community. We're using time as a resource and moving to mirror the state's posture in order to better prepare Buncombe County for our response. I'll turn it over to Jennifer Mullendor, our Director of Medical Services.
Hi, I'm Jenny Mullendor. I'm the Medical Director for Buncombe County Health and Human Services. And I'm going to provide a little situation update of the status of COVID-19 in the state as well as locally. So as of 2:30 today, there are 14 presumptive positive cases of COVID-19 in North Carolina, one confirmed positive. So a presumptive positive is one that was tested through the state lab or potentially through LabCorp. Confirmed positive means it was confirmed to be positive at the CDC. At this time, we have no cases of COVID-19 in Buncombe County. There are several people who are under investigation who have been tested for COVID-19 in the county, and we in public health are working closely with our local medical community, including Mission Hospital, in making sure that those people are being managed appropriately and that there is no risk of exposure to anyone else in the community. We are providing guidance for preparedness and response to our local medical community, to local schools, to long-term care facilities and congregate living facilities, to employers, pushing messaging out so that people have the information they need to be prepared and to help prevent infection and spread of infection in the community. If people in the community develop symptoms like fever, cough, difficulty breathing, what we want them to do is the following. If they are critically ill, if they are struggling to breathe, that would be the time to call 911 and communicate with the EMS dispatcher about what's going on so that they can make the appropriate decisions on how to respond. If you are not critically ill and you have a primary care provider, please call that primary care provider before you show up at their office. Call them so that they can screen you over the phone and assess the situation. They will then reach out to us in public health for additional guidance if necessary, so that we can make sure that we are managing your care appropriately and not potentially exposing others to infection. If you do not have a primary care provider, one option would be to call an urgent care. again, have them assess you. The other option is to call us at the Buncombe County Health and Human Services. Our communicable disease nurses can help, again, assess the situation and determine the best course of action. To reach our communicable disease nurses, the phone number is 828-250-5109. And we're having a very high volume of calls. You can imagine medical providers are reaching out to us. And so I ask that the public only use that phone number if necessary. If you don't have a physician that you can see, you're unable to get in contact with an urgent care, then call that number. But we're trying to enable our communicable disease nurses to do the work they need to do. And be assured that we will notify the public if and when we get our first case of COVID-19 in the community.
I'm interrupting
Yeah.
you quick. For people who are calling in, can you please make sure that your phones are on mute? We're getting reports that there's some feedback for our callers, so please take that step now in order to hear. Thanks. Okay.
So yesterday, when the governor declared a state of emergency.
Will you introduce yourself, please?
Hi, I'm Taylor Jones. I'm the Emergency Services Director for Buncombe County. And so I want to talk a little bit about what happened yesterday when the governor declared a state of emergency. That's allowing us to do certain things to pre-posture and to get reimbursement for our costs and things like that as we move forward. So that was a really key to our emergency operations center that we're going to be standing up tomorrow, and that state of emergency kind of builds into that. So that.
As Taylor mentioned, I'm Avril Pender, County Manager for Buncombe County. As Taylor just mentioned, when the governor made the announcement yesterday about a state of emergency for the state, it prompted us to then look at ourselves at a county and how do we start preparing and pre-positioning ourselves to make sure we're prepared for the community. So today, we've asked the chairman of our board of commissioners, Brownie Newman, to sign a declaration of state of emergency for our community. Along with that, all the municipalities in the county, including Asheville, City of Asheville, Black Mountain, Montreat, Weaverville, and Woodfin, have all agreed to join the county in that effort. So I'll turn it over to the chairman that he can say a few words and then sign that declaration.
Great, thank you, Avril. I'd like to acknowledge some of the other elected officials that are here with us as well. We have the Mayor of Asheville, Esther Mannheimer, with us. Mayor, thank you for being here. And then from the County Commission, Vice Chair Jasmine Beach, Ferrara, Al Whitesides, and Amanda Edwards. Thank you all for being here. Let me just read the declaration, and then I'll sign it, and then I'll just say a couple of words about it. A declaration of a local state of emergency. The following declaration is issued by Brownie Newman, Chair of the County Commission, on behalf of the Board of Commissioners of Buncombe County. Whereas COVID-19 is a respiratory disease that can result in serious illness or death by the SARS-CoV-2 virus, which is a new strain of coronavirus previously unidentified in humans, which can spread from person to person. Whereas in response to the global spread of the virus and the disease it causes, the World Health Organization has declared COVID-19 a public health emergency of international concern. The Centers for Disease Control and Prevention has warned of high public health threat posed by COVID-19 globally and in the United States, and has deemed it necessary to prohibit or restrict travel to areas designated by the CDC. The United States Department of Health and Human Services Secretary declared a public health emergency in the United States for COVID-19, and the North Carolina Department of Health and Human Services has confirmed multiple cases of COVID-19 in North Carolina. Whereas on March 10th, 2020, the state of North Carolina, through the Office of the Governor, Roy Cooper, issued Executive Order number 116, titled Declaration of a State of Emergency to Coordinate Response to Protective Actions to Prevent the Spread of COVID-19. Whereas in consultation with healthcare professionals and based upon guidance from CDC and North Carolina DHHS, arrangements must be made immediately to take such actions as are deemed necessary and appropriate to ensure that COVID-19 remains controlled and that residents and visitors in Buncombe County remain safe and secure. Now, therefore, pursuant to the authority contained in Chapter 21, Buncombe County Code of Ordinances, and Article 1A of North Carolina General Statute, Chapter 166A, the Board of Commissioners hereby declare a local state of emergency for Buncombe County beginning upon adoption of this declaration and shall remain in effect until rescinded. By and with the consent of the mayors and municipalities within Buncombe County, this declaration of local state of emergency applies within the municipal limits of the City of Asheville, Town of Weaverville, Town of Woodfin, Town of Black Mountain, Town of Montreat, and the Town of Biltmore Forest. It's further declared that the emergency management plan adopted by Buncombe County and that all applicable mutual assistance compacts and agreements are in effect and shall remain in effect until this declaration expires or is rescinded. All emergency management and health and medical services personnel are hereby ordered to cooperate in the implementations of the provisions of the county's emergency management plan. We direct that copies of this declaration be disseminated to the mass communications media for publication and broadcast, and that a copy of this declaration be posted at the county courthouse and other public buildings as appropriate, adopted this 12th day of March 2020. So I'm going to sign it. And just to make a couple of remarks about this, several people have asked what's the real purpose of signing this local emergency declaration. There's three things I would point to. First, this declaration makes Buncombe County and municipalities within Buncombe County eligible for state and federal resources as they become available to help address the COVID-19 issues. Second, we think it's very important to just send a clear message to our community that this is a serious public health concern, but that there are practical and effective steps that we can all take as individuals, families, businesses, local government, and organizations that can reduce the spread of COVID-19. The message that I would send is that I urge all members of this community to avoid public gatherings that are not essential at this time. From other parts of the world that have been wrestling with this for longer than we have, we know that taking this step is one of the most effective things that we can do to slow and prevent the spread of this illness, which will help more people from getting sick. And finally, it allows all units of local government here in Asheville and Buncombe County to work together in a coordinated fashion and to speak with one voice. So thank you all for being here today. And who's next?
Okay. So before I turn it back over, and Taylor, I'll start off and then you can jump in here if you don't mind. As he mentioned earlier, the county has also decided today to look at a partial activation of our Emergency Operations Center. That means that we will be looking at our leaders across our community to join us on a daily basis to start monitoring and preparing our community for COVID-19. Our plan right now is to open that EOC. This is not the toilet.
Everybody is ready.
I'm just, but on a serious note, we are very, very engaged each day, talking to each other, and we want to have that in the same space. So we are going to open up our EOC and activate that, and what that means for us, and I'll let Taylor, our Emergency Management Services Director, talk about that in a little bit. But we intend to have our school systems, our Red Cross, our Asheville, all of our municipalities as well, in that room so we can make decisions. And as it impacts our community, we can be prepared to do that. So I'll turn that over to Taylor to have some more conversation with EOC and then Janet.
So one of the most important things a community can do when they're facing a crisis like this is come together in a unified command and make decisions jointly that affect the good and better good of our community. So some of the things that we're going to be kind of pre-positioning and looking ahead is actions of setting up coordinated test sites in the community so we can test folks, and to ensure that our community, gets the best level of care across all levels of discipline in the community, where that's emergency services capabilities, looking at being able to respond to those needs immediately, and to have flexibility during this crisis to do things a little different than we normally do. So one of these things that we're looking at different is how we respond to sick calls. So if folks call in, and they have basically chills, fever, respiratory symptoms, things that meet the manifestations of flu or COVID-19, instead of sending an ambulance out, we're going to send our community paramedics out to reduce our exposure in our community and look at what kind of home care initiative we can do. We're doing this in conjunction with our public health partners and with our medical direction with our medical director here with Buncombe County. So that's one piece that will look different from our day-to-day response, and that EOC group and how they function to help us carry out and be more flexible in our response message. But also, we're looking at other things like getting our parents to pre-plan about if schools have to be closed. Right now, we're not looking at any closure because we're looking at other things like the higher risk population and how we can get the message out to nursing homes and talk with them about how to actually call in and actually report these cases, how to isolate high risk patients. So all these conversations will be kind of driven by our Emergency Operations Center and our planning as we go forward. Some of the other things that we plan on doing is a lot of situational awareness of what's going on in our high-risk areas and planning for that, but also looking at large-scale events and what the exposure may be there and what the risk is. Because a lot of what we do in emergency management is determine the risk and vulnerability to our community. So that takes pulling all that partnerships together from all our community partners, such as the Red Cross, the MANA food groups, looking at feeding, kids afterwards, talking with the school districts, folks that may not have opportunities to have access to food daily. So these are kind of things that we're going to be working on together as a community as we stand up and prepare for this crisis. And this emergency declaration, both at the state and local level, gives us a lot of flexibility to do that. And so we thank y'all for those initiatives.
Good afternoon, everybody. It's a pleasure to be here. I'm Bill Hathaway. I'm the Chief Medical Officer for Mission Health and the North Carolina Division of HCA Healthcare. In my capacity, I have responsibility not just for the patients and friends and family members in Buncombe County, but across the 18-county region. We recognize our role as the tertiary and quaternary care provider for the entire Western North Carolina community. And I just want to start by saying it's a privilege to be able to work and partner with the representatives that we have here from the city and the county and our emergency preparedness partners. A couple of things I want to address off the bat, some of which has already been said, is that there have been rumors going that we have identified cases so far of patients who have been infected. That's not the case. At this point in time, we have had a number of people who qualify as PUIs, to use the colloquialism, persons under investigation. None of them have proven to test positive at this point in time. So that rumor needs to be out there. That's not to say that we won't see this illness in our community. We fully expect to see this. That's why we've declared a state of emergency and why we're preparing today, and why we're partnering together to spread what we hope, or to prevent the spread of what we know will be an illness that comes to our community. We've taken a host of specific measures across the hospitals in our health system, and there are 7 different member hospitals, which include, many of you are aware of, some visitation restrictions. They're minor at this point in time. We are screening all the people who enter our facilities, both in our practices and in our hospitals, to assess them for symptoms of cough, shortness of breath, and fever. Those are the hallmark findings of this illness. We also screen for a travel history, and then we're encouraging those who are sick, unless it's a really dire situation for their family member in our hospitals, not to come to the hospital and expose themselves to potential illness or expose others to that illness. So that has taken place. We have not implemented any more strict visitation restrictions at this point in time, but that may happen in the future depending upon how things go. And that's for the protection of our community. So we want to make sure that people realize why that would happen if it would happen. We are actively planning both to help prevent this across the counties. I had a phone call this morning with Dr. David Ellis, who's the Chief Medical Officer at Pardee, and with Dr. Teresa Herbert, with Advent Health System in Fletcher, and with Steve Smith, who's the Health Director in Henderson County, and Dr. Mollendor. We have a weekly call set up so that we're coordinating efforts outside that which is happening here, and I want you to be aware of that. And we're specifically focusing on that group at looking at the skilled nursing facilities and how we can protect that most highly vulnerable patient population that we to have a situation similar to what happened in Washington State could really be a challenge for us. And then last but not least, I want to emphasize that in addition to these preventive measures that we're all partnering to do, we are gearing up to be ready for a surge if it's necessary. We're blessed in this community to have a facility like Mission Health. The capacity of that institution is unbelievable. The technology in there is beyond compare. And most importantly, the world-class care delivered by the physicians and the compassionate nurses that we're blessed to have in our community is really absolutely amazing. So I just want people to realize that we're not just preparing to prevent this, we're preparing to take on the situation when it arrives.
Thank you, Dr. Hathaway. And now we'll open it up to questions.
How many tests have been performed in Buncombe County?
I am not able to give you a specific number. Now that commercial lab testing has opened up, and the number I would give you anyway would probably change in the next hour. I would probably venture to guess, in the dozen plus.
Yeah, dozen range. We've tested. We've had 4 negative tests. We have 3 pending tests right now in our system across the 18-county region.
And what are the criteria for people to be eligible for testing? We understand that's changed.
Right, and so for testing through the state lab of public health, there are maybe more stricter criteria, but what has opened up has been that if you have fever and lower respiratory symptoms, which means cough or shortness of breath, and you have a negative flu test, could be a rapid flu test, or it could be a PCR test, those people can be tested for COVID-19. So that was a game changer. That really opened up testing, and that's testing that can be done by our communicable disease nurses out in the field, or now can be done by providers in the community with commercial labs.
And when did that open up?
That was, keep my days straight, the 10th,
Yes, 2
I
days
think
ago.
March 10th.
All right, is that included within that dozen cases?
Those are the tests
Those
that
are
we've done
tests.
to date, yes.
And those are cases, those are,
Or, yeah, sorry.
yeah.
I think it's
Let's be
important.
clear.
Yeah.
All right.
I think it's important to emphasize that the testing is really designed to rule patients in. As we have more widespread availability of the testing, it'll be to rule patients out, but we are not advocating
Right.
testing of low-risk people, and certainly not advocating testing of anyone who is asymptomatic, even with a travel history right now, okay? Asymptomatic people, we may have specific recommendations in partnership with the health department, but no testing at this point.
Just to make it easier for the folks who are calling in, as you get questions, will you repeat the question so that the folks calling in can hear? Thanks.
And Dr. Mollendor, can you expand a little bit on, you said you're working with PUIs to manage them. What is that?
Working with providers.
You're working with providers.
So when a person is identified who meets criteria for testing, again, they can come through different routes, right? So it could be that EMS transports a patient to Mission Hospital. It could be that a provider calls us and says, hey, we have a patient. Or it could be that we identify a person. Testing is done and we give guidance based on the potential that person is infected. We issue guidance on them staying away from other people. Does that answer your question?
Yep.
Sorry, I didn't do it. I even wrote here, repeat questions. Sorry, I was writing that.
For Taylor, I wanted to ask you, I wasn't sure, But if you could expand on, you mentioned something about coordinating or setting up testing around the county?
So I'll go ahead and repeat the question. The question was testing and coordinating testing throughout the county.
So we've had discussion probably over the last week amongst those of us at this table and with some community providers about, especially in the days prior to March 10th, when there were very strict guidance on personal protective equipment that should be worn. So prior to March 10th, the CDC was very focused on healthcare providers having fit tested respirators when working with persons suspected of having COVID-19. On March 10th, I think I'm right on my day, the CDC relaxed some of that and said, because of the shortage of supplies, and said that surgical face masks, ear loop masks, could replace the respirators as long as all the other personal protective equipment was available. So like eye protection, gown, gloves. And that really, again, that along with the change in testing testing criteria really opened up the potential for more providers to test. And so there have been some discussions about setting up a testing site in the community where people who were referred by a healthcare provider could be sent to have testing done by people who are suited up appropriately. So it'd just be, you might have seen, they've done this in other states.
Like a drive-through.
Like a drive-through, right? South Korea did this. Washington State has been doing this for symptomatic healthcare workers.
Yeah.
And so we're in active conversation currently with some local medical providers about how would that look in our community. And I know that I have been in conversation with the State Division of Public Health about this, like if they have a model. And so I know that this is a work in progress, I would say, not just for our community, but for other communities across the state.
Yeah, let me just amplify that one bit. One of the benefits of being part of a large healthcare organization like we are now with our recent affiliation is that we have 185 hospitals across the country. Unfortunately for them, many of those hospitals have a much greater experience with sick patients. We have hospitals in Florida and in the far west who have experienced that. And they have extensive experience in their communities. We're going to tap into that and collaborate and cooperate across all the healthcare providers here to make sure that we don't do unnecessary duplication of services, that we have a coordinated effort to make this roll out well for the community when it's necessary. Fortunately, right now it's not necessary, but now's the time to prepare.
I'm bouncing around a little bit over here, but what can you tell me is being done with the county jail population to ensure their safety?
So the question is, what has been done with the county jail population to ensure their safety?
So, this is Dr. Mullendor again. So I have shared guidance with the Sheriff's Department, the leaders who manage the jail. Guidance from the state, guidance from what they're doing in other states that are more highly impacted. They've been working on their plans, their preparedness plans, looking at how they would manage if a case or a person under investigation popped up within their population, talked about visitor restrictions. So there's active, ongoing, again, planning, preparedness, response. They do have on-site medical at the facility, and so those medical providers get my emails that I share widely with healthcare providers in the community, so really making sure they're just part of the coordinated effort.
Thank you.
Mm-hmm.
So we're live streaming, and a lot of our viewers are concerned about schools, saying that they're going to take their kids out whether it's canceled or not. What will it take for schools to be closed?
So the question is, a lot of viewers on live stream are asking about specifically the school closures and what kind of response we would have and what would activate school closures.
All right, so this is Dr. Mullendor again. So guidance from the CDC and the state Division of Public Health is that we don't take school closure lightly. We have to remember the impact that closing a school would have on the community, right? That where are those children going to go, right? And we also have to remember that the highest risk population for this infection is, again, people who are over the age of 65, people with high risk underlying medical conditions and weakened immune systems, right? And so we've been in discussion with the schools from the very beginning, and they have done a great job getting their schools prepared and implementing mitigation strategies, increase their cleaning, planning for the potential for school closure. So preparing for virtual learning, one-on-one learning. So they're doing everything they can to get prepared for the potential. At this point, I think we're going to push out messaging through the schools tomorrow to parents, again, encouraging them to prepare for the potential and really want the parents and guardians of high-risk children to consider that's the population within the schools that we're most worried about, right? And so maybe those children need alternative learning situations right now. Maybe the parents of those children need to bring them home.
I'd like to speak a little bit about the coordination going on between Buncombe County government, particularly public health, and the school systems. So we are very closely communicating with both Buncombe County schools, Asheville City schools, county charter schools, and higher education, AB Tech, Montreat College, and any educational source in the community. We've had several meetings just today alone to address this issue. It's an ongoing conversation. We are not going to make any decisions without having an in-depth conversation with those school administrators.
Can I add one more thing? And this is in specific reference to still being a parent, but not of children of that age. The disease is really interesting and something that troubles us or perplexes us, I guess I should say, with respect to understanding how it affects different populations. While it certainly can infect children, they seem to be less affected in terms of severity of illness, which is really fantastic. I mean, that's wonderful in and of itself. Where, in fact, earlier this week, and I don't know if this has changed, I had heard that in the Chinese population, no one less than age 29 had died of the disease. So it's clearly different in that population versus the older population. Where we worry about children is their ability to help propagate the disease throughout the community. And so if we did do that, I think it's important to recognize that that's a preventive health measure more so than it is a public preventive health measure, more than it is to protect individual children, although both are critically important.
Right. And again, the schools are making plans so that if when children aren't in school, then do they have access to food? So know that these preparations are happening. The schools are working very closely with their staff and partners in the community to make sure that they're prepared if we ever get to that point.
How about public meetings? Oh, sorry.
Caller, question on the phone?
Yes, I just would like to know about how the county is handling the homeless population and tourists.
Yeah, so the question was, how are we handling the homeless population and tourists? So one issue, if we have a person under investigation, our initial inclination is we always want to have them isolate and quarantine in their home. It's easy and it's very comfortable for them. There are certain populations that might not be a good option. One is for people experiencing homelessness. Another is for tourists who maybe don't have the finances or the ability to extend a hotel stay. And then we also have people who have homes, but for whatever reason, it's not supportive of isolation and quarantine. Maybe they have vulnerable family members living with them. Maybe they have shared spaces. So we are pursuing, we're engaging in constant conversation with community partners, hotels around the area to provide support for that. So we want to make sure that those people who don't have resources in a place to isolate and quarantine, will provide that for them to make sure they're not out in the community and give them a warm, safe, comfortable place to be for that duration.
And I would also say, this is Dr. Mullendor, I'd also say that we are in communication with those service providers, right? So providers who serve serve persons who are experiencing homelessness, and we have also pushed out information to local hotels and other employers, businesses in our community.
I'll add one other comment. At our county commission meeting on Tuesday, we have on the agenda to appropriate $250,000 to the county manager to take additional steps as needed to, take appropriate steps to help manage this challenge as we go forward. So if there are additional resources needed for things that were not already in the county's budget, before we knew we'd be facing this issue this year, there will be resources available so that we can do things that were not already appropriated in the budget as needed to address things like the question around how we can provide shelter for folks who may not have personal resources to those kind of facilities at this time.
I have a question about that funding. Are there any plans to hold a special meeting to authorize the funding before Tuesday?
So the question is, are there plans to hold a special meeting before Tuesday to authorize the funding?
There's not. We're planning on appropriating those funds at our meeting on Tuesday.
Do you think because this is evolving so rapidly that there will be daily briefings instead of once a week?
The question is, this is a rapidly evolving situation, and if we're going to have more media availabilities more than once a week, we're having that discussion. This Monday we stood up a joint information center, and so we have more capacity to respond to media requests. That's a conversation we're having. Keep in mind that we have capacity issues. We are responding to this right now. This media availability is part of our planning and response activities, and we have to have that response globally. So we will look at that for more options.
What is your thinking on prohibiting large gatherings?
So the question is, what are we doing on prohibiting large gatherings? We are anticipating from Governor Cooper later today some guidance on mitigating factors for the communities, specifically for mass gatherings. We don't have details of that yet, but as we stand up our state of emergency and our emergency operations centers, we will be pushing specific guidance for the community for mass gatherings.
What are your plans to reach the Latinx community that are not English speakers?
The question is, what are our plans to reach the community who are not native English speakers?
Latinx, yeah.
So, as part of the Joint Information Center we stood up, we have a special team assigned in there for accessibility to include non-native speakers or deaf and hard of hearing. As you can tell, we have an ASL translator here with us today. We have a team doing translations. So all the guidance we're pushing will be coming out in English and Spanish. And we're working for resources to create videos for the deaf and hard of hearing, working very closely with that state institute. So we're engaged in that. We also want to talk about, apart from language, to make sure we have equitable communications, to make sure we're not using inappropriate terms like hotspots and victims, but we're using thoughtful, equitable, so we're not targeting any community negatively. Yeah, and we'll include it in Russian as well.
Are there any more questions from those who are on the phone? Okay.
I have one more question, sorry. So you said you have some pending tests out. I'm sorry, I just don't have a sense of the scope. How many tests are you still awaiting results, or about how many?
So you've heard the number when a person becomes a PUI when they have a test sent.
Oh.
So that defines a person under investigation is when they have the test sent. You can expect that with wider spread availability of the testing that the numbers of PUIs or persons under investigation is going to climb significantly across the region in the next number of days. That is not a reflection of anything, meaning there's wider spread, because we're just being more, the blanket is being spread broader and over whom we're trying to take care of. And so we just want to make sure that we're investigating as much as possible at that point in time.
So if you've had about a dozen tests sent and none confirmed positive, or does that mean that those dozen have been confirmed negative, or they're?
So as I mentioned earlier, within our facility, we have our facilities, at this point in time, we have 3 or 4, it's increasing daily. So by the end of the day, it'll be more than that of people who have tests pending. The turnaround time on the test at this point in time is 3 to 4, sometimes longer days. So it takes a while for us to get those tests back before we can rule those patients out. Does that help?
Yes, it does. Is Quest Diagnostics here locally, have they been certified to do the test?
So the state does the testing and then LabCorp does the testing.
And so you would have to ask them directly. I have heard, if I can say anecdote, I have heard from one provider who does use Quest, and he does have test kits. And then I've heard from other providers that they were not able to get test kits. So I don't, again, I have, providers are reaching out to the commercial labs themselves. We don't have to do that because we have state lab testing, and we are focused then on the people who can't get to their primary care provider, or can't get to an urgent care. And it's evolving, right? As more commercial labs develop their tests and more companies develop tests, the tests should become more accessible, right? I know that
So
was
there are tests that are pending now.
Correct.
Of course.
Yes.
And so how many of those are there?
Well, again, I mean, what I tell you right this moment is probably going to change in an hour.
It's changing as we speak.
Yeah, and so at last I knew, we had 5 tests pending at the state lab through our county health and human services. Yeah.
Last chance for questions. I would like to remind everybody that a great resource for information as the situation evolves is www.buncombecounty.org/bcready. That's where we're putting all our latest guidance and information.
And before everybody leaves, can you say your name and spell it? And we'll start with Commissioner.
Sure, I'll start. Brownie Newman, BROWNIE,
Avril Pinder, AVRILPINDER.
Fletcher Tove, TOVE.
Jennifer Mullendore, MULLENDORE, and I'm the medical director for Buncombe County Health and Human Services.
Taylor Jones, Emergency Services Director for Buncombe County, TAYLOR, Jones, JONES.
William Hathaway, HATHAWAY, Chief Medical Officer for Mission Health in the North Carolina Division of HCA Healthcare.
All right, thank you, everybody. We appreciate you attending. And again, just remind you, we appreciate you being here as partners in our response.